hydrocodone, or that could be alcohol, that there cause chronic pain. Some of the most common are different musculoskeletal pain conditions such as fibromyalgia, osteoporosis, and arthritis. Arthritis is one of the most common disabling conditions in the United States. It includes digestive pain conditions such as pancreatitis and inflammatory bowel disease, and nerve pain conditions such as reflex, sympathetic dystrophy, and other nerve pain such as nerve pain in the legs, arm, and back. So that is the connection, if you will, as we're just having this discussion on substance use disorder and the disability community. We see that there is a very high level of comorbidity for individuals that are that have disabilities and using substances. So the next question that we have that needs answered are, what are some barriers then to individuals with substance use disorders and disabilities that they experience in our communities, specifically barriers to education, barriers to employment, and barriers to treatment. And just to broadly talk about inclusion, inclusion is a critical piece of recovery and physical and mental well-being for individuals who have substance use disorder and other disabling conditions. We know that Americans with disabilities are some of the most isolated individuals in the United States due to access issues, stigma, discrimination, etc. So individuals with SUD, they tend to encounter numerous barriers in accessing employment, education, and treatment. People who have substance use disorders, psychological conditions, and physical conditions can exacerbate one another when one of those conditions or more is not managed appropriately. And lastly, the stigma of substance use disorder, which we're going to talk briefly about here, often prevents individuals from disclosing and requesting needed accommodations in educational and employment settings. So we know with disability and disclosure, once you disclose your disability, you unlock any stigma that your employer or your school might have toward that condition. And so for people with substance use disorder, the high levels of stigma and discrimination they experience due to their condition, people saying, well, why don't you just quit? It's not a real disease. This is a choice that you're making. Those attitudes, unfortunately, and those experiences they've had lead them to not disclosing and not requesting accommodations that might actually help keep them in school and help keep them in the workforce, and which is a very valuable part of their recovery, is being able to have those activities, being able to have a steady income source, have health insurance, etc. So want to briefly touch on the importance of work. So why are we including employment in this conversation? Well, work has consistently been identified as one of the most critical factors in determining somebody's overall well-being and quality of life. There's been a multitude of research studies done on substance use disorders and employment, and they've shown that employment has a positive impact on a person's quality of life, on their overall life satisfaction, on their overall health, on their social well-being, and on their personal acceptance of disability. In fact, employment and stable housing have consistently been shown in recovery research as being the two most powerful predictors of positive recovery outcomes. So does the person have a job? Do they have a steady stream of income? And do they have a safe and stable place to live? Some of the benefits of having income and work, steady stream of income, can include reduced financial stress, which can be a trigger for relapse, access to stable housing, which I just mentioned the importance of. It enables access to health insurance and treatment. So financial reasons is one of the biggest reasons people don't seek treatment for substance use disorders. They can't afford it or they don't have health insurance. And it improves overall life outcomes for individuals and family members. So not just the people with the substance use disorder, but it helps improve outcomes for their family members as well. So just as employment has a very positive impact on individuals with substance use disorders, unemployment has an extremely negative impact. So those who are unable to access educational opportunities, which then lead to improved employment opportunities, and employment opportunities, are at a much higher risk of relapsing and using substances again. And given how crucial employment is in the recovery process, the estimates of unemployment rates for people with substance use disorder, which range from 65% to over 85%, is a serious cause for concern. So what are some of these specific barriers that individuals with substance use disorders face to attaining education, training, and employment opportunities? First and foremost, a lot of these individuals reside in areas that have fewer employment and career opportunities. We mentioned areas earlier that were hit very hard, like areas that relied on manufacturing and coal industries. We talk about the Midwest as the Rust Belt, and Appalachia in different ways. It's also experienced a loss of industry as well. And those areas with fewer employment opportunities tend to see some of the highest rates of substance use and the highest rates of overdose deaths from substance use. Another issue, maybe even in urban areas where there's fewer employment and career opportunities, is poor access to childcare, which prevents somebody from maybe working certain schedules or working a full-time job. Another barrier that kind of flows naturally from education to employment are lower levels of educational attainment. People that struggle at very young ages with substance use disorder maybe they don't finish high school, or maybe they finish high school and they're not able to get into an apprenticeship program, a training program, get an associate's degree, get a bachelor's degree. They tend to rely very heavily on part-time and temporary positions, which don't provide a lot of benefits and a lot of continuity. And they tend to have to work for very small businesses because those are the only individuals that will hire them and give them opportunities. Generally speaking, people with substance use disorders tend to lack soft skills. So they might have difficulty with interviewing. They might have difficulty with punctuality, consistent attendance, so what we call absenteeism. They might have difficulty with appropriate dress, personal grooming, and hygiene. They might also have difficulty with relationships in the workplace, such as getting along with supervisors and peers, communicating professionally, and empathizing with employer perspectives. The other concern is not only the substance use disorder, but these comorbid medical conditions that we've been talking about, the other disabling conditions they might have as a result of or in addition to their substance use. Because of their substance use, they might have lost social and family support, and they might be engaged in illegal activity as a way of accessing or getting money to access substances that they feel like they need. So substance-related legal charges tend to create criminal records, which creates many barriers for both education, licensing, certification, and employment. And for those of you in the VR field like I am, if you've worked with individuals with substance use disorders with criminal backgrounds, you know that can be very difficult to find employers that are willing to give them interviews and to hire those individuals, especially those who require drug tests or background checks. And so in the workplace, substance use can have a very negative impact. On average, an employee with an active substance use disorder can miss nearly 50% more days of work than somebody without a substance use disorder. If you combine that with the frequent loss in productivity due to absenteeism and presenteeism, presenteeism refers to being at work but not being very productive. And that is from the combination of both their substance use disorder and their other health-related complications that are very common with SUD. That becomes a problem. And then if you have to lay somebody off, discharge somebody, or due to a substance use disorder, that's a high cost to the employer to replace that employee. It's estimated that the cost of replacing an employee is between 25 and 200% of their annual compensation. And that doesn't include the cost of loss of company knowledge, continuity, and productivity. Employees using substances can have a negative impact on employee morale, increase the incidence of interpersonal workplace conflict, and can be a major driver, unfortunately, of workers' compensation costs. So you can see why employers might be hesitant to want to hire and retain employees who have substance use issues. Although we do have a lot of really positive reasons why it's a good idea too, why we think it's a win-win for people that do have best practices in place and hire individuals with substance use disorder. You can see why the rationale for an employer might be, yeah, we're not interested in hiring somebody with these issues. So shifting that, I'm going to talk a little bit about the stigma of substance use disorder and the workplace discrimination experiences that they might have. So people with substance use disorder do encounter very high rates of stigma and significant barriers in the workplace. One of those is coworker attitudes and treatment toward individuals. Coworkers often believe that their fellow workers are at fault for their conditions and could choose to get better if they wanted. It's a very common public perception that people with substance use disorders are a choice, not a disease, and that people could choose to get better if they wanted to. Now, those of us who've studied substance use disorder understand that that's not true, that it is a disease of the brain. And while treatment is possible and recovery happens, that it is a difficult day-by-day process for the people with it that go through it. And a lot of people, if they could choose to just get rid of it, they absolutely would. But those attitudes often lead to lack of empathy and support for individuals with substance use disorders. And it ends up in a lot of harassment and even altercations. As employers are including disability-related education, I think this is great when we talk about diversity, equity, inclusion, and belonging in the workplace. People are starting to think about disability as an aspect of inclusion, which is extremely important and an important aspect of diversity. We really strongly encourage and recommend businesses and employers to also include substance use disorders in that conversation. Because of the just sheer number of people using substances, most businesses, whether they know it or not, have employees that are dealing with these issues. And by choosing not to recognize that and provide adequate treatment and support for those individuals, they're doing nothing but hurting themselves in the process and hurting their business. So we're hoping that education and awareness can continue to increase the positive outcomes for people with substance use disorders getting into treatment, getting into recovery, and retaining or attaining jobs. Some research that we've done looking into stigma and workplace discrimination has shown that people with substance use disorders tend to report that they frequently experience discrimination directly from their employers, their supervisors, and even their representative bodies, such as their unions. What we found when we look at Americans with substance use disorders compared to people with other disabilities is they experience disproportionately higher numbers of discrimination in the areas of discharge, in other words, getting fired, hiring, in other words, not getting the job, and being suspended in their mind without cause. Individuals with a history of alcohol use disorder tend to report more issues when they request accommodations. So an example of an accommodation that someone with an alcohol use disorder might request is an extended lunch so they can go to an AA meeting across the street. And so when they request accommodations for their alcohol use disorder, again, they have to disclose to their employer their condition. And they report that the employer or the businesses typically have a lot of issue with them, and they're not getting the accommodations they need to be able to manage their alcohol use disorder. People with a history of drug use disorder specifically report more issues in the process of being hired. And so for those individuals that have a history of drug use, they encounter a lot of issues when it comes to trying to get jobs to begin with. So our last piece here, I want to talk about barriers to treatment. And this really kind of integrates this idea of people with both medical or physically disabling conditions and substance use comorbid conditions. So the individuals in treatment tend to report more frequent stigma experiences and perception. And where are those coming from? They're coming from treatment professionals. And unfortunately, many of us who work in the field, whether we mean to or not, are acting in a way that these individuals are perceiving as discriminatory. In fact, they report that a lot of the prejudice they experience is directly from their treatment providers. So discriminatory experiences in treatment, those greatly decrease the likelihood that someone will continue to seek treatment. I mean, and that just makes sense. You know, if I'm going into treatment and the people that are working with me aren't being very kind to me, they're not being understanding and empathetic, or they're making snide remarks to me or passive aggressive comments, why would I continue in that treatment? It's estimated that individuals with substance use disorders who also have a comorbid disability only seek treatment between 1.5 and 10% of the time. So extremely, extremely low rates of treatment seeking in individuals with comorbid SUD and other disabling conditions. What's interesting is despite the Americans with Disability Act, there is still a ton of physical accessibility issue with treatment facilities. In fact, one study found that between 20 and 40% of treatment facilities in the United States still had inaccessible parking, restroom, bathrooms, and hallway stairs. And treatment denial rates are still extremely high for people with physical disabilities, again, despite 30 years now of the ADA? So treatment denial rates for people with substance use disorder and other disabilities were as high as 66%. For other mobility disabilities, it was 65%. For people with spinal cord injuries, it was 67%. For people with traumatic brain injuries, it was 68%. For people with muscular dystrophy, it was 75%. And for individuals with MS and substance use disorders, they had reported an 87% treatment denial rate. So I want to pause here. We're about halfway through the presentation. We've talked about the substance use crisis in the United States. We talked specifically about the opioid use epidemic in the United States and the overdose deaths. We talked about the 3 phases of the opioid use epidemic. We discussed the comorbidity between disabling conditions and substance use disorder, why it's important for those who work in the mental health or disability fields. And then we discussed barriers to education, employment, and treatment that people with substance use disorders and people with comorbid substance use disorder and other disabilities would experience and encounter. And so I just want to take a second to pause and take any questions before we get into the second half of the presentation.
Dr. Leslie, it appears we do not have any questions at the moment. If an attendee does have a question, please feel free to put it in the Q&A box at the bottom of your screen, and we will be glad to take that question. If you have a comment, feel free to put that in the Q&A box at the bottom of your screen, and we'd be happy to to respond. We do not have any questions yet.
Okay, wonderful. Well, again, feel free to ask any questions or make any comments. If you have any feedback for us, we'd love to hear it. So as we shift into the second part of this presentation, we're going to get into what's happening right now with COVID-19 and how that impacts what we've established is this population of individuals with substance use disorder and people with comorbid substance use disorder and other disabling conditions. It's been called by many a double epidemic, as we see the intersection of the COVID-19 pandemic with this national substance use crisis that we've referred to currently happening in the United States. So let's just take a brief second, and I'm sure many of you know this, and this is just review, but for those of you that maybe are still trying to figure out more information about what is this COVID-19 thing that's happening. So COVID-19 is a disease. It's the name of the disease. The long name of the disease is novel coronavirus 2019, which is shortened then to COVID-19. It's called COVID-19. The CO stands for corona, the V for virus, the D for disease, and then 19 for 2019, which is the end of 2019 is when this disease was first discovered. So that's how we get COVID-19. That is the disease. The virus that causes COVID-19 is called severe acute respiratory syndrome coronavirus 2, or for short, SARS-CoV-2. COVID-19 is the disease caused by the virus SARS-CoV-2. In much the same way, AIDS is the disease caused by the virus HIV. So what is COVID-19? It's a virus. It's very closely related to the SARS virus that caused the 2003 outbreak. There are many types of human coronaviruses. Many of them we know under the pseudonym, the common cold. That the coronaviruses tend to cause mild upper respiratory tract illnesses. Obviously, this coronavirus, the COVID-19 disease, is capable of causing severe upper respiratory tract illness in some people. And those with different types of disabling conditions tend to be the most at risk for severe illness from infection as well. This virus is new. It's not one that had been seen before prior to 2019 in humans. Currently, you've probably heard a lot about variants and coronavirus variants. So just wanted to unpack that very quickly as we talk about how these waves of COVID variants continue to present issues for us from a public health perspective. So a variant occurs when a virus's genes change or mutate. In RNA viruses like SARS-CoV-2, it is the nature of these viruses to continue to change and evolve gradually over time. So there are many variants. Some have been causes for concern, and you've heard about. Some have not spread widely and been causes for concern. The first variant that was very much a cause for concern for us was the Delta variant. This became a dominant variant this previous year for us in 2021. The Delta variant was estimated to be twice as contagious as the initial variant that we experienced in the US, and it is thought to have been a cause of more severe illness than the original variant. And the vaccines that we were using tended to be slightly less effective against the Delta variant compared to the original variant that we experienced. And then the most recent variant that has kind of taken the country by storm, if you will, has been the Omicron variant, which became the dominant variant in late 2021 in the United States. It's thought to spread even more easily than the Delta variant did, but it's not clear if it causes more severe disease. In fact, there's a lot of research that maybe suggests that it is less severe illness causing than the Delta variant was, which is good news in some ways. Right now, the Omicron variant is so widespread that nearly 100% of COVID cases in the US are estimated to be due to the Omicron variant. Even people who are fully vaccinated can get breakthrough cases and spread this virus to others. It is likely that as time goes on, there will be more future variants of interest and concern as this virus, SARS-CoV-2, continues to evolve and change. The most recent data we have on COVID-19 tells us that there have been around 413 million cases of COVID worldwide. And it appears that nearly 6 million people have died due to COVID-19 infection. In the United States specifically, we've reported nearly 78 million cases of COVID-19, which is almost a quarter of our population. We've also reported nearly 1 million deaths in the United States due to COVID-19. 54% of those deaths have been male, and 3/4 of them have been individuals over the age of 65. So the question becomes, how or what is the connection between COVID-19, substance use, and disability? Well, the first thing we've seen has been a substantial increase in overdose deaths in the United States that has coincided directly with the COVID-19 pandemic. Now, we had seen an increase even before the pandemic hit, so we can't say that there's causality here necessarily, but there certainly seems to be a relationship there. What we also know is that having a substance use disorder is a risk factor for contracting COVID-19 and for getting a severe illness once you contract the disease COVID-19. So you're more at risk for getting it, and once you get it, you're more at risk for severe illness from it. We also know that COVID-19 and long COVID, or what's called post-COVID-19 syndrome, can result in disability and functional limitation. So I've talked about kind of this broad idea of disability in general. Well, we also know that substance use disorders are a type of disability. And what we've also seen is that COVID-19 itself, especially post-COVID syndrome, appears to be a disabling condition. And with disability and functional limitation, we know comes an increased risk of developing a substance use disorder. Next, the COVID-19 pandemic has also coincided with extremely high unemployment rates, especially for Americans with disabilities. And as we've discussed already, unemployment puts somebody at higher risk for mental health and substance use issues. And if we know that Americans with disabilities are at higher risk for substance use disorder and from unemployment, it means that people in the American disability community are at an increased risk for substance use disorder currently. Unemployment, as I mentioned, is a risk factor for both developing a substance use disorder or relapsing an existing substance use disorder. And when you're not employed, you typically don't have access to affordable health care, which unfortunately results in reduced treatment-seeking behaviors. It means fewer people are getting the treatment that they need. Access to healthcare treatment has continued to be an issue during the pandemic. This includes access to really relevant and helpful peer support groups like Alcoholics Anonymous or Narcotics Anonymous, AA or NA. Unfortunately, due to social distancing requirements, These groups oftentimes were temporarily canceled and have had to find new ways to meet, such as meeting virtually. But many will say that the experience hasn't been the same. While it's been valuable, it hasn't necessarily been the same. Many individuals also experienced an increase in mental health symptoms and social isolation as a result of the pandemic, which both increased the risk for substance use disorder. So as I've kind of broadly laid this out, I want to get more specifically into each of these points as we move forward here. First is, how has COVID-19 led to an increase in substance use issues? Well, our early data has suggested that rates of substance use have increased, as have the death rates due to overdoses since the COVID-19 pandemic hit. So in the year 2020, we saw 93,000 overdose-related deaths, which again coincided with the onset of the COVID-19 pandemic. This is the highest year of overdose deaths on record in the United States and was a 30% increase from the previous year. In the year 2020, it was reported that 4.1 million people initiated alcohol use, and 1.2 million people started misusing prescription pain relievers as a result. So substance use initiation was much higher in 2020, which again directly coincided with the onset of the COVID-19 pandemic. How is substance use disorder a risk factor for COVID-19? Well, the Center for the Center for Disease Prevention and Control tells us that living in a congregate setting, homelessness, or incarceration all increases risk of exposure to COVID-19, which individuals with substance use disorders at much higher rates live in congregate settings, experience homelessness, and deal with incarceration. Having a substance use disorder can also make you more likely to get severely ill from COVID-19. Why? Well, as I've mentioned before, substance use disorder is connected with high-risk underlying medical conditions. Examples being chronic lung disease, chronic liver disease, and serious heart conditions. We know that COVID-19 has a really negative impact on respiration. For people that continue to use opioids due to addiction during a COVID-19 infection, opioids also cause respiration issues, which can lead to severe respiration complications for individuals who have COVID-19 and continue to use opioids. Stimulants can lead to acute heart problems and strokes. So can COVID-19. COVID-19 has been shown to put somebody at increased risk for clotting and stroke and heart issues. So continuing to use stimulants while you have a COVID-19 infection can complicate each other and cause heart issues. And lastly, people with substance use disorders often have conditions that impact their immune functioning, such as HIV or hepatitis C, particularly those IV drug users, which being immunocompromised is obviously a concern for individuals if they contract COVID-19. Speaking of COVID-19 as a disabling condition, different common long COVID symptoms include fatigue, shortness of breath, cough, joint pain, and chest pain. Other long-term symptoms that have been noted include muscle pain and headache, fast heartbeat, loss of smell or taste, memory, concentration, or sleep problems, and rash and hair loss. There's evidence from research that organ damage can be a result of a COVID-19 infection, particularly the organs of concern are the heart, the lungs, and the brain. And that COVID-19 puts somebody, as I mentioned, at risk for blood clotting and strokes. So again, it's safe to assume that people with these issues, with these symptoms, might be more likely to encounter substance use disorder. What about all the stressors? So I'm sure that all of you, as you've lived through this pandemic, have experienced some increased stressors. And we all know that stress is a trigger for relapse for people with substance use disorder. And I mentioned unemployment is also a trigger for increased substance use as well. So what happened during the COVID-19 pandemic? Lots of stressors, and unemployment reached record rates. So after years of unemployment being around 4%, in April 2020, we saw an unprecedented rise in the unemployment rate to 14.4%. This was the highest unemployment rate we've seen since in the post-World War II era. In fact, the unemployment rate climbed higher in 3 months than it did during the Great Recession in 3 years. The current unemployment rate for people with disabilities, the latest data we have, is around 9.7% compared to 4.3% for people without disabilities. Again, talking about that comorbidity, for people with disabilities, unemployment leads to higher risk of developing and relapsing in substance use. 9.7, not a good statistic, right? That's not something we want to see if we're looking to improve substance use outcomes. Unfortunately, these numbers are even understated because there's been such a sharp decline in labor force participation rate, especially among people with disabilities. They've looked to avoid the workplace, especially those who are at higher risk for contracting and for severe illness from COVID-19. There's also been high rates of individuals reporting issues with access to adequate food and ability to meet household expenses. So talk about stressors. You don't know where your next meal is going to come from. You don't know how you're going to pay rent next month. You don't know how you're going to help pay for your kids' expenses. Unfortunately, families with children have reported higher rates of financial issues. And these issues have specifically been problems for people in disadvantaged populations. So specifically Black Americans and Latinx Americans have experienced the highest rates of issues with access to food and ability to meet household experience compared to their white Caucasian counterparts.